Hello friends, in this video we will be discussing about the various parts of the membership of Royal College of Emergency Medicine, and also I've got a very special guest who would give you few tips how to prepare, what to read, which books, which resources you could use, and how to basically get your MRCEM, that is the membership of Royal College of Emergency Medicine, and how can you further proceed with that MRCM further in your career, like how can you get into training, the various training pathways, and of course his take home message. So watch the video till the end and definitely like, share and subscribe guys, and let's go to the video. Hello, friends. Welcome to UK Dreamers. Today we'll be talking about the Royal College of Emergency Medicine membership exams. And to enlighten you guys about this exam, we have highly esteemed Dr. Sajjad Pathan, sir, who is, since I was preparing in my early days of emergency medicine, I prepared a lot from his videos. I've benefited a lot. So, without further ado, I welcome Dr. Sajjad Pathan.
Hi. With regards to the preparing for the MRCEM exams, there are three parts to this exam. One is the MRCEM primary, then comes the MRCEM intermediate, which is a single-based answer format again, and thirdly is the MRCEM OSCE exam. These three exams, once you pass them, you are eligible to receive a certificate of membership from the Royal College of Emergency Medicine. So let us talk about the MRCEM primary exam. The question is, where do I study from and where do I begin? The first thing I would say is go to the college website, which is mrcem.ac.uk, and download the 2010 curriculum of the basic science. The MRCEM primary will consist of 180 questions over a 3-hour period, and you need to get around 110 to 120. The marks do differ each setting to pass this exam. And the curriculum tells you all that is needed. You don't have to study in depth beyond anything not given in the curriculum. So it deals with basic sciences related to emergency medicine. It's a single best answer format, and the resources wise, as I told you, get the curriculum and do one, or I would say just one question bank available in the market. And in addition, to support your studies, you can watch my videos on primary, and that should be sufficient for you to pass this exam easily. It should take roughly about 3 to 4 months of 3-hour study time daily. In terms of the MRCEM intermediate, the curriculum has recently changed. So the pattern of exam has also changed. 2 sittings have been done into the single best format. Not many books are available at the moment. However, one book I would strongly recommend is the one written by Ashish Banerjee and Clara Oliver. That book covers what is needed for the MRCEM intermediate exam completely. This is again a single best answer format, 90 questions for 2 hours. Then you get 1 hour break and 90 questions again for 2 hours. The passing mark again ranges between 110 to 120. Not many resources are available. I have tried to make some videos on YouTube regarding it. You can look at it and then just enroll for one of the question banks. This should take somewhere around, again, 3 to 6 months of dedicated study. And do not, if you look at the regulations properly, the regulations will ask you about a few things like stable patients, unstable patients, trauma, pediatric procedures, and medico-legal aspect. So if you look at the stable patient, it is given equal importance to the number of questions asked in trauma, and it's given equal importance to the number of questions asked in the resuscitation, unstable patients. So do not press yourself to learn the whole of the, in the past, how you used to learn cardiovascular, genitourinary, GIT. Do not emphasize too much in depth for that. Emphasize on resuscitation, trauma, pediatric. That will save you a lot of time studying, and that will fetch you the maximum marks. And the medical legal aspect, which is hardly like 10 or 12 pages in that book. Uh, Apart from that, I have written a book. At the end of it, there are two full SAQ exams. And from the feedback which I've received, many of the questions in this recent diet were directly from those two mock exams printed at the back. So that would be a good thing to do as well. In terms of OSCE, the OSCE consists of, as far as I remember, 18 stations, out of which you have to pass 14 stations. I believe the pattern of that exam has not yet changed, and there will be 18 stations, 7 minutes each. You will be given 1 minute to stand outside and read the instruction, and 7 minutes inside to carry on the instruction. For passing the OSCE, there are a few courses which are conducted in India, but most important would be reading one of those books called 110 Cases. Secondly, there is geeky medic videos on YouTube that will be helpful. And be very loud and clear. If you're taking that exam in India or out of the UK anywhere, the likelihood of you passing the exam is much higher. The reason I'm saying that is while you're doing those exams over there, you're competing with people who speak your language, which is not English. So the exam is conducted in English, and you are compared apple to apple. But if you come to UK and do that exam, you're competing with the local population who's been trained during the medical schools for these OSCEs. So in terms of the OSCE, as I said, practice is very important. You need to practice with a friend, with your partner, with your kids, in front of the mirror, with a pillow, but practice is most important. You need to take that other person as a patient and talk to him as if he is the patient. It is also possible to practice these scenarios in work settings. If you have a colleague, ask him to observe you and give you a feedback, and take his feedback seriously. And that's it about the MRCEM exams.
Thank you, sir. So thank you for giving a brief overview about the exams. So what happens if one gets the full membership exam cleared? How do they proceed? Like if they want to come to the UK, what are the prospects and the pathways for them, sir?
In terms of once you get your membership examination done and you are registered in the college as a member of the Royal College, you can apply for your GMC registration directly by yourself. The only thing you will have to do before doing that is you'll have to do the English exam, which is either IELTS or OET. Once you finish these exams, you can apply to the GMC. The GMC will invite you for an identification check before they issue you your GMC number. And then once you get your GMC number, you can apply for a job over here and come and work in the UK at a registrar level.
Okay, sir. So could you give a brief overview, sir, regarding the training pathways per se for our colleagues?
So the training pathways are, if you have done your MRCEM, you have three options to pursue. I will give it in order of what should be the priority. The first pathway is getting into a training program via ACCS route, which is a run through. You get into ST1 and complete out at ST6, and then you are on the specialist register. For getting in that, you need to do another exam called MSRA exam and sign off your CREST form, which is basic competencies related to your internship. So I would say roughly you would spend about a year in the UK understanding the system before you get into training. So your MSRA exam and CREST form, and then you apply for the training and you get called for the interview. Your MSRA scores and the interview performance weigh equal importance to get into the training. That is first pathway. Second pathway is if you want to get directly into an ST3 level or ST4 level. That's possible, but it's highly, highly competitive. Again, but remember, it's very, very competitive. to enter into a direct ST3 pathway at the moment. And the last option would be you do not enter into training, carry on working at a registrar level, gather all the competency sign offs required as like a trainee up to ST6 level, and do 4 secondments, 3 months each in PEDS, anesthesia, ITU, and acute medicine, and get those signed off. You have all the evidence now of all the workplace based assessment. You have a 4 to 5 year of appraisal portfolio, and you will be doing simultaneously some quick project, at least one in the whole 4 years or 5 years time. And you can apply through Article 14 to get onto the register, which is known as Certificate of Eligibility for Specialist Registration, CSER. So that is another pathway to become a consultant. That's what I did because there was no guidance available for me to enter into training when I came here.
Thank you, sir. Thank you for sharing that information. So, sir, what would be your take-home message for our colleagues who want to enter into emergency medicine? They don't know it about the exams which you've discussed now, and also unsure about whether they should actually enter into training or not enter into training. Like,
my take home will be if you have decided to come to UK, then definitely first choice will be to enter into a training program. Getting Caesar support is not very easy. Most programs may say we will provide you, but there's a lot of hard work, and the responsibility lies on you if you are trying for the Caesar pathway. But if you are a trainee, the responsibility is shared by the trainee and the deanery. So the deanery will try to regularly keep a check on you whether you have completed certain competencies or not, so that you progress, and they will provide you with all the support. So getting into training will be my first choice.
okay, sir. Thank you for that. So, guys and girls, if you've got any further queries regarding, MRCM or how to get into training or any of the emergency medicine preparation issues, you can leave us a comment below. Dr. Pathan has a very good YouTube channel as well. You can serve. I think it's Dr. Sajjad Pathan. If you search on YouTube, you'll find the various videos that Sir has made. And yes, keep preparing for emergency medicine. It's a great field, and definitely it's fruitful for all of us. So thank you so much, Dr. Pathan. Thank you so much for your valuable time.
Thank you, Aman. Thank you. The take home message I will give you is, guys, don't stress too much about these exams. Take it as a process. Enjoy the experience of the exam. And whatever the outcome is, don't think too much into the outcome. Just enjoy the whole process and enjoy the process of exam. That's it. Good luck with your preparation. Thank you.
Thank you so much, sir. Thank you. Bye bye, sir.
Bye.